Good afternoon. My name is Armando Evans. Today we're going to look at pneumonia. Pneumonia is one of the most common disease that we have in Zambia. So, it's a very important topic, and I want everyone to concentrate. When we talk about pneumonia, our objectives we are going to discuss it as in general, and also we are also going to define what pneumonia is. Then we are going to outline the classification of pneumonia, the pathophysiology, signs and symptoms, and also how we can manage and the complication as well. So those are the outline, introduction, definition, causative agent, mode of transmission, classification, pathophysiology, complication, and then management. So, in our introduction, we say pneumonia is a severe form of acute lower respiratory infection that specifically affects the lungs. So, this condition primarily affects the lungs. Okay, it doesn't affect any other part of the body unless it's go into complication, but it's primarily its primary effect is the lungs. So it is a common illness which occurs in all age group. So pneumonia doesn't choose the group. Okay, it can occur in children, it can occur in adults, it can occur in middle-aged people, and so on. So it doesn't choose. It can occur in any group, and it's a leading cause of death among children under the age of 5 years. So for those children who are under the age of 5 years, especially that their immune system is very low, it's this disease is usually deadly and to them. The elderly and people who are chronically and terminally ill. So basically, these people who are elderly and those who are the elderly, those who are chronically and the terminally ill, their immune system underperforms. As a result, this condition can worsen and it can also lead to death. So, during a pneumonia infection, the alveoli of one or both lungs fills up with pus or fluid. This increases the level of breathing, and thus gaseous exchange cannot occur as it normally would. So, most of the times, the alveoli, that's where, in the alveoli, specifically in the air sacs, that's where gaseous exchange takes place. So, when this disease occurs, it will actually take up the space in the alveoli, in the air sacs there. As a result, the gaseous exchange will be compromised. Then the prognosis depends on the type of pneumonia. There are different types of pneumonia. So the prognosis or the end result for this disease, it will depend on the type of pneumonia, the treatment, and also complication, and also the person's underlying health. If the person is not ill, if a person is maybe having that type of pneumonia which is not deadly and there is appropriate treatment, basically this person will be recovered, unlike the otherwise. Pneumonia is an acute inflammation of the lung parenchyma caused by various microorganisms. Or pneumonia is an infection that inflames the air sac in one or both lungs. So here in short, we are just saying it is just an acute inflammation of the lung parenchyma. So what it means by acute inflammation of the lung parenchyma, there are parenchyma cells in the lungs. So this disease primarily affects these cells in the lungs, okay, causing them to be inflamed, okay, by various microorganisms, which includes the bacteria, and also, but the most common is bacteria, though there are others like parasites, but the most common cause of pneumonia is bacteria. So, or you can say pneumonia is an infection that inflames the air sac in one or both lungs. So, as it can be seen there on the diagram, there is when someone inhale a bacteria through breathing, through inhalation of air, they will go to the bronchioles, and then from the bronchioles, so when the bacteria being inhaled, it will travel from the esophagus, it will travel to the primary bronchus there. As it's traveling, it will also leave some inflammation, because for inflammation to take place, is the immune system, the body will recognize the bacteria, and then it will release certain factors we call histamine and other co-mediators, which will affect the bacteria. But in return, the bacteria also produce certain chemicals. As a result, there will be inflammation of the lung. So it will travel from the primary bronchus to go to the secondary bronchus, from there tertiary, and then finally to reach the alveoli where there are air sacs. And then from there, that's where gaseous exchange coming on, because in the alveoli, that's where gaseous exchange takes place. So when the bacteria reaches here, it will initiate the same inflammation, and then there will be inflammation which will take place. That's the reason the gaseous exchange won't have the space to take place. So someone will be having will be having difficulties in breathing, which is dyspnea, nasopharyngeal, because they want to get in the air. So that was just a recap. And then we are saying conservative agent can either be bacteria, virus, fungi, protozoa. And then for the most common one is the bacteria. Okay, so among the bacteria, there is Haemophilus influenza, Streptococcus pneumoniae, Streptococcus agraxa, Staphylococcus aureus, Klebsiella, Legionella, Pneumophila. And then among the viruses, there is respiratory syncytial virus, adenovirus, influenza virus, severe acute respiratory syndrome. Fungi, there is Cryptococcus, Histoplasma, Pneumocystis carinii. Protozoa, there is Mycoplasma pneumoniae. So, for the mode of transmission, the microorganism may gain entry into the lungs by one of the following. It can either use inhalation, as you are inhaling, as someone is inhaling air, they might end up inhaling together with the bacteria. It can also maybe through aspiration of organisms from the nasopharynx or oropharynx, or hematogenous route. So for hematogenous spread, when someone or when a person have maybe a certain wound, the bacteria will have an entry or will gain an entry, because that's the point of entry. So the bacteria will gain an entry and it will cause pneumonia. So classification may be classified according to acute source of infection or anatomical structure. So for classification, there are different classification. So pneumonia can be classified according to anatomical structure involvement. Okay, and that will be called bronchopneumonia, because it will involve the bronchial. Then lobar pneumonia, it will involve the lobe. So number 1, according to anatomical structure. Number 2, according to the source of infection. So for example, if it is caused by the community, it is called community acquired pneumonia. Okay, as the name implies, develop outside of the hospital healthcare environment. So this type of pneumonia, which is community acquired pneumonia, it is acquired outside the hospital. Okay, so for example, during NMCZ, if they ask you a question to say, suppose someone comes from home, okay, or let's say if someone is discharged, they go home. After discharge, they assessed. Before they discharge the patient, they assessed this patient had no pneumonia, okay, and then he is discharged or she is discharged, go home, and then after a week or 2 weeks, then this patient comes back claiming to say, I have pneumonia. So this type of pneumonia, it will be called community acquired pneumonia, because during or before the patient was discharged, it was okay. Then after being discharged, went to society in the community, and then comes back with this pneumonia. It means this patient acquired pneumonia outside the hospital. But there is also hospital acquired pneumonia. So for hospital acquired pneumonia, this type of pneumonia, an individual will acquire this type of pneumonia within the hospital environment or within the hospital during the hospitalization. Okay, so if a patient had other condition, for example, this patient had the let me give an example to syphilis or any other medical condition, and then during the hospital stay, this patient also developed pneumonia during hospital stay. So this type of pneumonia, it will be called hospital acquired pneumonia, because the patient acquired pneumonia within the hospital. So according to cause, sometimes it can be according to cause, such as aspiration pneumonia. So due to inhalation of fluid, food, or vomitus into the airway, common in a newborn baby. For the babies, they have premature respiratory distress syndrome. Okay, so they usually have their immunity or their capacity for their capacity or their unconscious is very low. So if they are unconscious, they won't be able to actually get rid of any fluid which is coming out from their stomach. As a result, the vomiters will end up going to the nostrils. The most common form of aspiration pneumonia is bacterial infection resulting from aspiration of bacteria. Then there is also hypostatic pneumonia due to immobility, common in bedridden patients. So for hypostatic pneumonia, it's those who don't move. Okay, they are bedridden, they don't move, they are just enclosed. They may end up having this type of pneumonia, because in those who are bedridden, there is poor circulation of blood in the lungs, which result in fluid collection and filling of air sac and hindering of gaseous exchange. Then you also have pneumoconiosis. So pneumoconiosis is a chronic respiratory disease related to inhalation of dust. So just to summarize the pathophysiology of pneumonia. So as you can see there, it's oxygen. This person is inhaling oxygen. but in that oxygen there is a bacteria. So when this individual inhales oxygen, he or she is also inhaling together with the bacteria. So this bacteria will travel from the nasopharynx. It will travel until reaches the lungs. Okay, so when it reaches the lungs, in the lungs there are different parts there. So there is the bronchus, there is the bronchi. Okay, so it will travel. As it's traveling, it will start causing inflammation. Okay, because inflammation is coming about due to the response, the normal response of the body, the physiological response, because of the immune system. So the immune system will recognize to say there is a foreign body which has entered. As a result, the immune system also release certain cofactors such as the histamine, which will fight against this bacteria. Okay, so apart from the cofactors, there is also the white blood cells which will be released as well, so to fight against this bacteria. So those are the things that will cause inflammation. So this bacteria will travel until it reaches the air sac. Okay, so when it reaches the air sac, the fight or the battle between the immune system and the bacteria is also keep on increasing. So when the bacteria is being killed by the white blood cells and or other cofactors of the immune system, that's the end of pneumonia. Okay, so in the process of inflammation, there are a lot of things that is going to happen. Okay, so there will be protein. The protein will be displaced. Okay, and also the gaseous exchange will be compromised, because in the air sacs, specifically in the alveoli, that's where the gaseous exchange takes place. So it will be compromised because of the inflammation that is taking place there. So we are saying the normal lung is free from bacteria because of the presence of a number of lung defense mechanisms. Okay, so in the normal life, the lung is free from any bacteria. Then nasopharyngeal filtering action, mucociliary action of the lower respiratory airways, the presence of phagocytosin, alveolar macrophages, and immunoglobulin. So in short, the lungs, they are free from any other microorganisms. So what will compromise the lungs is the bacteria which has entered. Okay, so in the inflammation, there will be congestion. So the first stage, which will last for 24 hours, there will be congestion. In this congestion, there will be outpouring of protein-rich exudates into alveolar space with venous congestion. Lung is heavy, oedematous, and red. Then red hepatization. This is the second stage, which will last for few days. In this type of in this stage, there will be massive dilatation of the capillaries. The capillaries will be much dilated. The lung appears red, solid, and airless. And then in gray hepatization, it will take after a few days. There will be destruction of red and white cells. So the mixture of red and white cells, it will look like a gray. That's the reason why it's called gray hepatization. Then resolution, if the immune system fight without involving any treatment, it can occur 8 to 10 days. Okay, but if it's treated well, with good management using medication, it can be even less than those days. So what are signs and symptoms? There will be dyspnea, high fever with chills, rapid respiration and dyspnea, cyanosis, nasal flaring. For nasal flaring, because this patient is trying to get ready of hair, but even if they are getting ready, they want to get rid of hair, still there is no place for gaseous exchange. So as a result, their nasal will be flaring and needing for the hair. There will be pruritic chest pain because of inflammation. There will be intercostal retraction, hemoptysis, sharp chest pain, and the prurient sputum, which is sometimes blood stained. So for complication, if it's not well managed, it can lead to septicemia, empyema, lung abscess, pleural effusion, pleurisy, and also meningitis, as well as endocarditis or pericarditis. So those are the complications, but for investigation, you can go with chest X-ray, sputum for culture, full blood count is also important. But for the treatment, amoxicillin is very important. So you can use amoxicillin 25 milligrams per kg 3 times a day for 7 days. Ampicillin 50 per kg IM every 6 hours, and gentamicin 7.5 milligrams per kg IM once a day for 5 days. So side effect is hypersensitivity. So for nursing implication, most penicillin can be taken with food to mitigate GI symptoms and encourage the client to drink more fluids to prevent dehydration. Alternative drug, chlorpheniramine, in case amoxicillin, gentamicin, and ampicillin is not there, you can still use these other medications such as chlorpheniramine, though there are side effects such as nausea, vomiting, headache, diarrhea. Okay, but still there are nursing implications. You assess for current symptom of headache, stiff neck, or confusion, and also monitor for side effect. Supportive therapy, you can give them oxygen, give a lot of oral fluids, balanced diet. Okay, so for nursing management, you can also do history taking, where you get subjective data. Objective data, you inspect the breathing, nasal flaring, lower chest indrawing, grunting, palpation, diminished tactile and vocal flameters, percussion. There will be downers, which indicate that there is fluid in the lung or collapse of part of the lung. You can also do auscultation, diminished breath sound during consolidation. Okay, so now since we know the condition, it's very easy now to nurse the patient using the nursing care plan. Okay, so to nurse the patient, you can just choose the local organ tune model of nursing care. Okay, or you can use nursing care plan. So for the main problem includes breathing, controlling body temperature, sleep and rest. So problem identified, you can say impaired gaseous exchange, impaired thermoregulation, pruritic chest pain, altered sleep pattern, fatigue. Nursing diagnosis there, you put ineffective gaseous exchange related to accumulation of think secretion and fluid in the alveoli, evidenced by coffee or wheezing and respiration of 40 beats per minute. Okay, so then you plan now. Plan, you make your goal, and then you implement, then you evaluate. So in short, we are saying pneumonia is a serious lung infection that can be fatal if not treated properly. However, morbidity and mortality from childhood pneumonia has decreased, but a considerable prevention burden remains. Widespread implementation of available effective intervention and the development of novel strategies are needed. So otherwise, thank you so much for paying attention and learning.